I graduated in National University of Singapore in 2007. I'm a fellow of the FRCDS Australia. About 2 years ago, I did my master's in neuroscience from King's College. And I can tell you that a lot of the things that you learn in psychology, a lot of the things that you learn in neuroscience, the mental processes that you learn, part of it is incorporated in Primespeak. So it's not something that is a common misconception that most people have, is that because Primespeak originated from Australia, some people think that it's only applicable for like an expat kind of a clientele. That's not true. Okay, that's not true. I've worked in HDB practices. I've worked in town practices. It's applicable for every patient demographic. It's applicable for every nationality, every ethnicity. It works because it communicates at a very deeper level where you have a lot of innate human traits, that is the fear of high cost, right? No matter which country you go to, which ethnicity a patient is from, everybody does not want to spend more money than they need to. There's dental phobia, dental fears, the fear of needles. So these are real fears that patient has. Patients want to do as little dentistry as possible. That's part, whichever country you're going to, whichever patient demographics you have, these are very, very innate human qualities. And that's why it's applicable for almost every patient demographic. And that's why Primespeak is so effective in its communication techniques.